Hello everyone! October is an important month for the female population. Breast cancer remains a public health worldwide dilemma and is currently the most common tumor in the globe. October is established as the month of the breast cancer awareness. It's an international campaign to awaken the female population and to raise funds for research, prevention, early diagnosis, and treatment. Breast cancer is one of the most common cancers in women worldwide. Over 1.5 million women are diagnosed with breast cancer every year. Breast cancer is a metastatic cancer and can commonly transfer to distant organs such as the bone, liver, lung, and brain. Early diagnosis of the disease can lead to a good prognosis and a high survival rate. Breast tumors usually start from the ductal hyperproliferation and then develop into tumors or even metastatic carcinomas after constantly stimulation by various carcinogenic factors. Breast cancer develops through a multi-step process and the pathogenesis of this disease has not yet been elucidated. There are some genes which are related to breast cancer. Breast cancer-associated gene 1 and 2 are two famous anti-oncogenes for breast cancer risk. HER2, human epidermal growth factor receptor 2, EGFR, epidermal growth factor receptor, MYC, and RAS gene. There are different types, of course, of breast cancer. I'm going to show you now some of them. Angiosarcoma, ductal carcinoma in situ, inflammatory breast cancer, invasive lobular carcinoma, lobular carcinoma, male breast cancer, Paget's disease of the breast, recurrent breast cancer. Signs and symptoms that should activate the woman may include the palpation of a tumor or stiffness in the chest or armpit, change in the size, shape, or appearance of a breast, the appearance of changes in the color and textures of the skin, a newly inverted nipple, peeling, scaling, crusting, or flaking of the pigmented area of skin surrounding the nipple or breast skin, the secretion from the nipple, redness or pitting of the skin over the breast like the skin of an orange. However, the appearance any of them does not mean necessarily malignancy. Further testing will establish the diagnosis and the therapeutic manipulations. Of course, there are some risk factors. Gender. Women are more in danger to develop breast cancer than men. Aging. History of breast condition or breast cancer. Family history. Inherited genes. Doctors estimate that around 5 to 10% of the breast cancer are inherited genes. Gene mutations, radiation exposure, unhealthy lifestyle, environmental factors. Tests and procedures which are used to diagnose breast cancer include breast self-examination. Most of the clinicians encourage women to perform monthly breast self-examination to become familiar with their normal anatomy and empower them with regards to their own health care. Mammography is the best and the safest option and the most widely used. Breast exam, history, and physical examination by the doctor. Breast ultrasound. Removing a sample of breast cells for testing, biopsy. MRI. Different tumor markers. Fine needle aspiration. A thin prickle is employed to get cells from the abnormal area or a breast lump. Core biopsy. A wider prickle is used to get a portion of tissue from the abnormal area or the breast lump. Now, let's move to the treatment part of the breast cancer. The first choice is breast cancer surgery. which may include lumpectomy, mastectomy, removing a limited number of lymph nodes, removing several lymph nodes, removing both of the breasts. Of course, there are other therapeutical options such as anti-estrogen therapy, hormone therapy, which may include progesterone or estrogen receptors, aromatase inhibitors, or ovarian ablation, radiation therapy, chemotherapy, targeted therapy drugs, immunotherapy, and thermochemotherapy. The management of the breast cancer depends also on the collaboration of some teams, which include surgeons, oncologists, nurses, geneticists, reconstructive surgeons, and of course, the patients.
Never is too late. It's time about adapting lifestyle that reduces the impact of risk factors that we can control, such as body weight control, physical exercise, the cessation of smoking, reducing alcohol consumption, avoiding stress, a diet rich in fiber with a restriction of the consumption of processed foods. Secondarily, the scheduled, regular, preventive examination must be performed consistently as early diagnosis, which is the most effective treatment.
I must emphasize that this cancer is curable if it's detected in early stage, of course. We should not neglect our health due to the COVID-19 pandemic or avoid seeking for health care if we need it. Believe in the power of pink. Awareness is power. Thank you.